Mr. President, I want to talk about the health care bill, the health care issue, and talk a bit about how we can find a solution and then what the solution should look like. For the last 2 days, as a member of the Armed Services Committee, I have been in our markup. And in that markup, we considered somewhere in the neighborhood of 250 to 300 amendments. Of those 250 amendments, approximately 210 of them were compromised, were worked out, agreement was worked out between the proponents of the amendments and those who had reservations, and they were either withdrawn or became part of the bill by unanimous consent. Of the 25 or 30 that were left for votes, however, we had good debate. The members talked about their point of view. The people who opposed them gave their points of view. We had a vigorous discussion and debate, and then we voted. And the important thing for me, and I'm pretty sure I'm right about this, I kept a mental note as we went through our votes. I don't believe there was a single party line vote in the Armed Services Committee on any amendment. The votes were sometimes more Republicans, more Democrats, but there wasn't a single party line vote. In other words, the process worked as it was intended to work, as it should work, and as it can work. So I have a radical suggestion for those who are seeking a solution to this health care issue, and that is submit a bill and put it before the requisite committees, have hearings, have debates, have information, get information from around the country, from experts, from people that know about the topic, and that's how we make good laws. A bill that doesn't go through any of that process, that's concocted in secret and sprung on the Congress at the last minute, almost by definition won't be a good bill. Bad process, bad bill. And that's what we had happen in this case. So I think this is a time we're going into a recess at the end of this week. Let's take a deep breath, and instead of trying to tinker around and attract a few extra votes and find something that will barely pass by the skin of its teeth, let's step back and submit this issue to the Finance Committee and the HELP Committee and try to work through to find a real solution, involving both parties, involving all of the wisdom that's been accumulated in this country on this incredibly complex and difficult and incredibly important issue. We don't have to try to do it in the dark. Let's do it in the light of day. Let's have open hearings and considerations and votes and amendments and discussion and debate, and then, as our system is designed, we can come to a good result. Now, let's talk about the bill that's currently before us. I guess it's before us. It hasn't really been submitted to any of the committees, but I'm told it's going to come to the floor. It was going to be this week. Now it's going to be the week, I guess, after the recess. At least that's what we were told yesterday. And why is this a bad bill? Now, I've been watching some of the commentary on this bill, and there's a lot of discussion about the Congressional Budget Office analysis. Is it correct? Did they use the right baseline? Are they good at projecting how many people are going to sign up for health care and all of those kinds of questions? And people are questioning the Congressional Budget Office. I happen to think they tend to be a pretty nonpartisan, straightforward, good scientific and quantitative analysts of these kinds of issues, and they've issued their report. 22 million people lose their health care. 22 million people. This is about people. It's not about ideology. It's about real people. Now, there's a really easy way to cut through all of the questions about whether they analyzed it properly and who's going to lose and who's going to win, and that is to look at a simple chart that's on, I think, the 3rd page of the Congressional Budget Office analysis. And this is really all you need to know about this bill. Medicaid loses $772 billion over the next 10 years, and the tax credit and selective coverage provisions, that's the ACA, loses $400 billion. It's $1.1 trillion out of the health system. You cannot take $1.1 trillion out of the health system and not hurt people. You can't do it. We don't have to argue about how many here and what age and all of that kind of thing. We're talking about a massive cut to the support that's enabling American people to get health care. In Maine, if you cut all these numbers back, the near as I can tell, it's about $400 to $500 million a year. I was the governor of Maine. $400 to $500 million a year is huge. And people talk about, well, we're going to cut Medicaid back, we're going to trim the growth rate, we're going to lower the way it's calculated and make it a per capita cap and all of these things. And we're going to give the states flexibility, the magic word, flexibility, as if flexibility enables you to somehow conjure up $1 trillion. What you're really giving the states is the flexibility to decide between the elderly and the disabled or children. That's what this is all about. There is another option, by the way. The states can always raise taxes to make up for this difference. And that's one of the most frustrating things to me, again, as a former governor. We're talking about this reduces the federal deficit by $330 billion over 10 years. Yes, because you've shifted almost $1 trillion to the states. That's nice work if you can get it. That's balancing the federal books on the backs of the states. If we want to make the federal budget look better, why don't we just let the states pay for the Air Force? That's a federal expenditure. Shift that to the states. That'll help us with our budget deficit. But it's a fake balancing of the budget because you're simply shifting the costs over to somebody else, another level of government. The shorthand for that is shift and shaft. And that's what we're talking about. Either the state government is going to be shafted because they're going to have to raise taxes, or the people who are going to lose the support are going to be shafted. And we're talking about real people. And let me talk about Medicaid for a minute. Medicaid is sometimes characterized, and I've even heard some of my colleagues use Medicaid and welfare in the same breath, as if Medicaid is a welfare program. It's not. It's a critically necessary support for health care for people who need it, many of whom are not welfare people as we would denote them, not welfare recipients. They're getting a lifeline, a true lifeline that's actually keeping them alive. In Maine, 70% of the people in nursing homes are on Medicaid. Nationwide, the number is 62%. So when you talk about Medicaid and cutting Medicaid, you're talking about Aunt Minnie in the nursing home. You're not talking about some welfare recipient that's ripping off the system. You're talking about your relatives who are in nursing homes. 70% of the people in nursing homes are being supported by Medicaid. In Maine, we call it MaineCare. So you can't shrink this amount of money and think that it's not going to have impacts on people. And that's why this bill is so pernicious. Now, here's what the bill's all about: a $500 billion tax cut to the top 2% of wage earners in America. Let's be clear what's going on here. There's an equation. $500 billion of tax cut, more than $500 billion of cuts to benefits. Money to the wealthy, health care away from those who need it. That's the equation. That's what this bill is all about. This isn't a health care bill. This is a tax cut bill dressed up like a health care bill. And it's also an ideological bill because people don't like Medicaid. Here's the problem. Our health care system is the most expensive in the world. We pay the most per capita for health care as anyone on the planet, by far. Just about twice as much as most other countries. If you do the math and you take the annual health care bill and divide it by the number of people in America, you get about $8,700 a year per person. That's what we spend on health care. So make that a family of four, that's $35,000 a year. That's what health care costs us. And by the way, that's the real problem. When we're talking about Medicaid and Medicare and Anthem and the private insurance and all of those things, we're really talking about who pays. The deeper issue is how much we're paying. And the problem is, and the reason we need Medicaid, and the reason we need Medicare, and the reason we need the Affordable Care Act is American people can't afford it without help. It's as simple as that. They can't afford it. They have to have, the government has to provide some support. If it doesn't, it would break every family in America. We have to have the support, and right now in the private sector, it's breaking our companies who are trying dutifully to keep up with the increase of costs in Medicaid, of health care. And don't fall for this idea that somehow the Affordable Care Act it caused all the increases. I remember, again, harking back to when I was a governor of Maine in the late 90s, early 2000s, healthcare costs were going up 6–8% a year. That was 10 years before the Affordable Care Act went into place. The individual market for health insurance was already on a drastic upward climb. So to blame it somehow on the Affordable Care Act just doesn't wash in terms of the history. So the problem is, the deep problem, as I say, is the overall cost of health care. We've got to start talking about that issue. That's a separate issue from what we're talking about here as to who pays. We have to talk about different kinds of delivery systems. We have to talk about a huge increase in preventive care. We have to talk about helping people to stay out of the hospital, to stay out of the medical system. The cheapest medical procedure of all is the one you don't have to perform. And so many of our diseases, our chronic diseases like diabetes, are based upon the choices that people are making and their lack of adequate care early in the disease. So that's a separate discussion, and I think that's one that we really have to look at. However this debate is resolved in the next few weeks or few days, we've got to talk about the deeper issue of the overall cost. If we don't get a handle on that, then all of this other stuff is just, it's going to be, it's not going to solve the problem. Because the deeper issue is the enormous costs that we pay in this country, almost twice as much as anybody in the world, anybody else in the world per capita. And you can say, well, but we have the best health care in the world. Yes, we do, for the people who can afford it. But for millions of people who can't afford it, who have either no or skimpy care, it's not the best health care system in the world. And there are no statistical indicators that tell us that we're doing really well on things like longevity, prenatal care, infant mortality. We're way down. We're like 17th, 20th. You'd think if we were spending the most money in the world, we ought to have really great results, and we don't. So that's something we got to talk about. The cost of pharmaceuticals, the cost of drugs is higher here than anywhere else in the world. And why is that? That's a problem that we have to discuss. I had a tele-town hall Monday night, sponsored by the AARP of Maine. At the peak, they tell me that there were 10,000 people on that call. And I took questions. And the questions from seniors in Maine were full of concern. Fear may be too strong a word, although in several cases it wasn't, but really deep concern about what will be the effect of this on me, on my mother, on people who are depending upon Medicaid for their care. One lady called who pays $8,000 a month for her chemotherapy drugs. If it weren't for her support under the Affordable Care Act and Medicaid, she said on the phone, I'd be dead. That's what we're talking about here. We're talking about real people. And then the final sort of general point I want to make before I talk about some of the people who are going to be affected by this is that I hear sometimes the proponent of saying, The free market's going to solve this problem. The free market is miraculous. It can solve all problems. I'm a huge believer in the free market. I'm a thoroughgoing capitalist. I started a business. I ran a business. I understand about the free market. The problem is healthcare is not a free market. If you go to buy a car, that's a free market. You can go online, you can compare, you can test drive, you can find the prices at the 4 dealers that are in your neighborhood. You can do all of those things. That's a free market. You don't have that in healthcare. Number one, you don't know the price. You call your local hospital, say, what'll it cost me to get my knee replaced? Nobody can tell you. You don't know the price. Number two, it's very hard to compare products. You can do it if you really dig and word of mouth, who's the good doctor, who isn't. Number three, you don't say what you want. The provider tells you what you need. Imagine going into a car dealer and the car dealer says, I'm going to tell you, I think you need this Mercedes over here. I think that's what you need. And by the way, you pay for it. And our system is set up that providers are paid for delivering a service, not keeping you well. They get paid by procedures, fee for service, not for keeping you well. There's no money in prevention. We have to change that. We have to change that. Now let me talk about people. And these are some people that I've talked about before, and I just wanted to sort of go through them. You know who this is. This is a Maine lobsterman. This is a guy who, his name is David Osgood. The ACA gave them a chance to get insurance. It gave him an opportunity to get insurance where it was practically impossible before. He said, it's given them some comfort, some reassurance. He said, we'll be okay. That's the main way. We'll be okay. This is one of the most independent, toughest professions there is in this country. But he's not part of a big corporation. He doesn't have somebody to pay part of his health care. He's got to make it work. And the ACA gave him an opportunity that he didn't have before to give some confidence to his family and to his life. There are about 75,000 people, by the way, in Maine, just like him, who, under the ACA, got coverage, many of them for the first time. And those are the calls we're getting from my office. Jonathan Edwards and Jen Schroth, and this is sort of a funny story. It tells you what Maine is like. I know Jen's mother. I used to work with Jen's mother in the early 80s. Maine is a big, small town with very long roads. We all know each other. And it just happens that here we are 25 years later, and I've become acquainted with Jen. She and her husband are farmers. They're small farmers in coastal Maine. She thinks it's irresponsible to go without health insurance, especially when you have a family, but it was so expensive, they couldn't do it. They couldn't acquire health insurance in the individual market, again, because they're not a member of a big corporation. The ACA gave them access to insurance for the first time, to real insurance, to insurance that would really cover what they needed. Not skinny insurance that only covers certain things and doesn't cover other things. That gives you the illusion of coverage until you go to make a claim. Jonathan Edwards and Jen Schroth, farmers in Brooklyn, Maine. That's the real Brooklyn, by the way, Brooklyn, Maine. Forget about that place in New York. This is Brooklyn with an L-I-N. Farmers in Maine, who the ACA gave an opportunity to get insurance for the first time for their family. Cora and Jim Banks from Portland. Raised 4 boys. This is amazing. Raised 4 boys. Every single one was an Eagle Scout. That's amazing. I mean, to be an Eagle Scout is a real achievement in this day and age. Cora worked at her home. She developed Alzheimer's in her late 50s. Tragically, that's a tragic disease. Tragic disease. And when Jim could no longer care for her safely at home, she went to a nursing home. And Medicaid helped her be there. Medicaid helped her be there. You start taking away Medicaid, what becomes of Cora? What becomes of Jim? He took care of her as long as he could. if she has to go home, if she has to leave that home, that's a tragedy for her and for her family. Again, as I mentioned before, 70% of the residents of nursing homes in Maine are on Medicaid. That's the kind of difference that it makes in real life. Here's Dan Humphrey. Dan Humphrey is a young man with autism who volunteers at a local soup kitchen, delivers Meals on Wheels in Lewiston, Maine. He depends on a Medicaid waiver to support his independent living. If it weren't for Medicaid, Daniel would be in an institution, or he'd be with his parents. They couldn't work because he would need care 24 hours a day. He does need care and support 24 hours a day. Under Medicaid, he's able to lead a real life and feel good about it. You can tell he's a great guy. Look at his smile. Medicaid's a lifeline. And I talked about Dan 2 or 3 weeks ago, and since then I've had an outpouring of people across the country, and especially in Maine, who have children or relatives or friends with disabilities, and what this has meant for them, and how terrifying it is that anybody wants to take $750 billion out of Medicaid, which is providing an opportunity for Daniel to lead a decent life. Why would anybody want to do that? I don't get it. I don't get it. Of course it can be made more efficient. Of course the ACA can be made more efficient, but not $750 million more efficient. That's a huge amount. $450 million a year in Maine. Daniel waited 8 years under the current program for the services that he gets now. And if we put in caps and block grants, that sounds good in Washington. We're going to put in caps. Caps mean Daniel may not get his services next year or the year after, or another guy like Daniel in Peoria or Philadelphia or San Francisco. That's a tragedy. These are real people. We're not talking ideology here. We're talking real people. And here's Lydia Woofenden. She lives near where I live. She just graduated from Mount Ararat High School in Topsom. 2 of my boys graduated from Mount Ararat. She even has a job she was offered after years of volunteering. Everything she has achieved has been accomplished by help with dedicated teachers, her family, and therapists, almost exclusively funded through special education in the public schools and Medicaid. And Medicaid. And by the way, having a child with disabilities has nothing to do with your income. It has nothing to do, you could be high income, low income, middle income. It has to do with the luck of the draw. It has to do with bad fortune. And it can hit anybody. So again, this idea that Medicaid is some kind of welfare program is just not true. It's not true. So, Mr. President, the reason I'm here is because of these people. The reason I'm here is to stand up for these people, because they can't be here to do it themselves. We can do better. The failure to get the votes to vote on this bill this week gives us all a chance to take a deep breath, to step back and say, sure, there are things wrong with the Affordable Care Act. There are things we can debate. There are things we can argue about. We can have amendments. We can do what we did in the Armed Services Committee over the last 2 days and have a real discussion and debate. I know it's possible because I sat there and saw it happen. It can be done. And we can do it here. Let's take a week, not to try to browbeat and push and incent and make special deals to try to get 51 votes or 50 votes, and then the vice president breaks the tie. It goes to the House. They don't even look at it. They'll pass it. And then we're embarked on a path that is going to really hurt the American people. We've got to have help. Health care is too expensive. and regular people in this country can't afford it. We've got to have help. And this is the place where people are looking to find that help. Let's try to work together. I'm certainly willing to work with anybody who will listen. But if they're starting from a premise of gutting Medicaid and giving somebody else a huge tax cut, that doesn't work. Let's talk about the real problem. You want to talk about health care? Let's talk about it. Let's talk about how we can lower the cost of health care, how we can lower the cost of deductibles, how we can lower premiums, how we can provide new options to people in their health insurance system. But let's just not talk about what we're going to do that's going to have such tragic results on individuals and families and on the fabric of our society. Mr. President, I believe we can do better. I believe we can do better. And we have an opportunity to do so. It sort of dropped into our laps this week. We've got 10 days to work on this, to think about it, to try to come up with a solution, or at least begin the process of a solution. There's no deadline here of next week, but let's begin the process. As I began, I have this radical idea of referring these bills to committees here in the Senate. Have hearings, get expert opinion, listen to the country, listen to the Hospital Association who says this is a terrible bill, the American Medical Association who says this bill violates the basic principle of the medical profession, first do no harm. This bill will do harm. There is no group that I've heard of that's for it. Only people that have an agenda to cut Medicaid because they don't like federal support, or people who have an agenda to change the Affordable Care Act because it has Obama's name on it. That's not a good enough reason to strike at the heart of our people, our communities, and our societies. One final point. I've been talking about people. Let me talk about jobs. In Maine, in 8 of our 16 counties, the hospital is the largest employer. I talked to a hospital director an hour ago. They are desperate about what's going on down here because it is going to really make it difficult for them to survive and serve their communities. The rural hospitals especially. I've met with them across Maine, in Farmington, in Bridgeton, Skowhegan, Lincoln. You haven't maybe heard of those towns because they're small towns in Maine, but they have a hospital that's the heart of the community and the biggest employer in the community. And they all told me the same thing. This idea, this bill, this approach is going to kill them. It's going to cause them to at least shrink their services or close. And in Maine, because we're a rural state with far-flung communities, that means people are going to be a long way from available care. An hour, 2 hours. And that's a tragedy for our communities in terms of economic development, in terms of jobs, but mostly, as I keep saying, because of people. People say, why are you so passionate about this, Angus? It's because this is what the people of Maine sent me to do. They sent me down here to help them, not hurt them. They sent me down here to speak for them, not stifle their voices. They sent me down here to do the right thing, to do the ethical thing, to protect them when nobody else will. That's why I'm here, Mr. President, and I believe that this Senate, this Congress, this government can do better, and I hope that we will.